The House is investigating Biden officials for trying to lower age limits for gender transition surgeries. In June, email excerpts showed Rachel Levine and staffers in the Department of Health and Human Services pressuring World Professional Association for Transgender Health to drop its age requirements for minors to obtain transgender surgeries in its standard of care update. Levine, a biological male who identifies as a woman, underwent a medical gender transition in 2011. Now, Representative Lisa McClain is writing to HH Secretary Xavier Becerra requesting all email documentation on the political interference by HHS into recommendations for treating youth gender dysphoria. McClain wrote, "The Biden administration's advocacy for expanding the pool of vulnerable children subjected to life-altering procedures they may later regret is reprehensible. Emails indicating that this advocacy was done for political advantage, possibly to satisfy extremist elements of its base, is even more outrageous." Draft guidelines published in December 2021 recommended lowering the minimum age for cross-sex hormone treatments to 14, transgender mastectomies to 15, breast augmentation and facial surgery to 16, and transgender genital surgeries to 17. Following the release of the draft guidance, members of Levine's staff asked WPATH to remove the new age minimums from the recommendations. One specific email outlined Levine felt the age limits would result in legislation for trans care. Well, since 2021, more than 20 states have enacted some form of age restriction on gender transition medicine for minors due to a lack of long-term evidence for the efficacy of reducing adverse mental health conditions. There have been several high-profile cases of teenagers who underwent surgeries as a part of their medical transition process and have come to regret surgical intervention.